So let me know if you have it. I drink so many fluids and I'm tired of water. So water is always going to be the best thing to drink during pregnancy, but I know a lot of people will like alternate water with like other stuff, or tell us in the comments what you like to drink. Please don't tell me wine. I'm not having that conversation today. So yeah, but hydration is so important, especially in the summer. It is really easy to get dehydrated. I live in Arizona, so yeah, you know what I'm talking about here. Ugh, guys, everybody seems to be falling today. I don't know what we're calling right now. Nobody wants to stay stuck. What about right here? Instagram. What should I pack in my hospital bag as a first-time mom? Excellent question, Maureen. Let's chat about it. So there's 3 things that I recommend everybody. Instagram, you're just going to be wonky. 3 things I recommend everybody have in their hospital bag that their partner knows where it is. Are we ready? Number 1, your external charger. Do not disturb. Do not disturb. Do not disturb. Hopefully it's on. 1, hospital or external charger, or your phone charger. Everybody wants that. Lip balm, because you're gonna have chapped lips. Instagram, you're killing me. I don't know why you can't play nice. And then what's the other thing? Scrunchie. Something to tie your hair back. Those are the 3 things everybody wants. They're always ornery. Oh my gosh. Cannot get these phones to play nice today. Let's try this. I have a whole hospital packing list that you can find on my site under resources. So you can go ahead and check it out there. I'd love to have you join up with me. Yeah, so anything else? I mean, that's why I have the packing list. Some people want to wear a bra. I always recommend that you have your like wear home outfit, which is something you would normally wear at like 6 months pregnant. I am not a heavy packer, and I think it's so much easier if you don't bring a ton of stuff. So grab the packing list. It's under resources. It's completely free. You can easily find it. Facebook, you guys got any questions for me? Let's see. Peaches, how do I feel the difference between Braxton Hicks and real contractions? So the main difference, which isn't fun at all, is that real contractions ultimately push your baby down into the birth canal and start active labor. Braxton Hicks may soften your cervix slowly. They may do nothing. That's a real difference. Both of them can be painful. Both of them can hurt like your full abdomen. Usually active labor has more symptoms than just contractions. So yeah. Kelsey, I bought your online course in 2021. I'm 16 weeks now. Will that course still be open? It depends on which one you bought. So if you bought the deluxe one, you have access forever, Kelsey. So check. But message me if you don't have access. We can make it work. Maureen, the hospital provides a lot for you. They do. They provide most things that you'll need. Their hospital toiletries are absolutely awful. Like awful, you guys. Awful. Yeah. So, they're awful. So I always recommend bringing your own toiletries, obviously. Yeah. Cramping normal at 27 weeks, not so much. I don't get TikTok DMs. I don't let people just message me on TikTok because there are way too many weirdos. So if you're having new pains that you're concerned about, I would recommend talking with your provider. Yeah, your own toiletries. Lotion, if you're planning to wash your hair or your body, I would bring shower gel, shampoo, whatever. Obviously conditioner. I never, yeah, anyway. I have this tailbone lower back pain at 16 weeks. Is that normal? It can be, Kelsey. A lot of times your uterus is just shifting around a little bit, but obviously any new issue you want to talk with your provider about. Does your OB/GYN check if you have eggs, or do you go to a specialist? I don't know. I don't know that much about like the early pregnancy, getting pregnant stage. So I don't have much for you right there. Tailbone pain was normal. In my case, Daisy said it can be. Yeah, but you want to check with your provider and just make sure. If you guys have questions, ask them below. I'm just going to stay on until I answer the questions, and then I'll be heading off. In case we haven't met, hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm also the creator of the online prenatal class for couples, the first hospital-based online prenatal class that was available online, which has been perfected to be available 24/7, created to help you and your partner get prepared for birth. And Kelsey took it. It's people think it's fun. They really enjoy going through it, so they actually learn rather than just like checking a box that they did a prenatal class. And it's only like 3 hours because I don't want to waste your time. I don't want to waste my time, and I don't want to waste your time. So yeah. Takia, I'm 32 weeks, but I have to be monitored every week because my baby's not growing. So will the doctor, not sure what, but yeah, so if baby's not growing, they should be taking multiple ultrasounds to see how baby is growing. Yeah, because it's just kind of a curve. You want to see how baby's growing. I was in a DV situation and my BP was really high, but back normal. Did that event harm baby? So babies are created to be fine for small bouts of stress. Now, if you're in long-term stress, like if you had stayed in that DV situation, then that's not great. So, yeah, that's the good news about babies. They're created to have small bouts of stress and do fine with it. What's your stance on circumcision? Man, I don't even know anymore. I had boys and I made my choice back then, but would I make the same choice now? I have no idea. Yeah. Do I smoke? No. Am I pregnant? No. When does baby's umbilical cord come off? My baby is 2 weeks old. Ugh, it's miserable. Did you happen to get it wet? If you get it wet, the longer it will stay on. Usually, I think average is a week, but if you get it wet, it can be on longer. If it smells or there's anything green coming out of it, you need to check with your provider and see if everything's looking okay. Daisy, let's see. How many children do you have? I have 3. My oldest is 24, though. I'm old. Will I get induced? Hard to say. Depends on if you want to be induced. Can you read my comment? I can read that. 4 months postpartum after C-section and just found out I'm pregnant. I'm not even probably sure. Congratulations. And it is what it is. And I've seen a lot of people who got pregnant very quickly after a C-section do just fine. That's all you can do. Make sure that you're monitoring baby's movement and all those different things, getting the ultrasounds, going to your prenatal appointments, and hopefully things turn out just fine. What is your take on high fetal maternity and mortality rates among people of color? It's horrible, Shay, and I'm hoping that we can fix the system. I'm working to figure out what more information I can bring them, how they can trust the healthcare system more, how we can be more accommodating of them. It's horrible. Yeah. I follow Your Birth Advocate on here, and I really appreciate what she brings to the. I'm not a person of color, in case you can't tell. Very white, but I've worked with lots of different nationalities. And honestly, in my mind, I was kind of surprised when I saw it. I thought it would be more people who didn't speak English. That's been the hardest one for me because I've done lots of Vietnamese patients, and I can only say 3 things in Vietnamese. I can say push, pain medicine. So it's horrifying, and I'm working. If anybody ever has tips or ideas, I'm here for it. Yes, Maureen, I could be your mom. I'm not gonna. Oh, I liked the live, guys. That's how on top of it I am. How dangerous is placenta previa? I'm 28 weeks at the moment. So placenta previa can be problematic. If you guys don't know what it is like where your cervix covers your cervix. Your placenta covers your cervix. So baby would not be able to come out the cervix if it stays there. Now, as the baby grows, a lot of times the placenta grows up the uterine wall and it ends up not being an issue. We actually don't see many people who have the issue, but yeah. I'm 36 weeks pregnant. Getting induced at 37, but just got told I'm anemic. Is this worrisome? Make sure that you're doing whatever they recommend to do. Is it taking iron? Is it just what they recommend you do? Montel asked on Facebook, I've been told to take aspirin due to my first baby being born in a smaller range. What are the pros and cons, if any? Montel, I've actually looked at the studies quite extensively about aspirin because, of course, when I first had a patient with aspirin, like that was a huge no-no in the beginning, but no issues with bleeding. There really haven't been any real issues. Sorry, that's kept in a little high. With aspirin, they haven't seen any issues so far. So because you had a small baby, there is a guess that maybe you had some preeclampsia brewing last time. So we want to try and prevent that this time. Huge fan of taking aspirin during your pregnancy. I actually just did a live last month with the March of Dimes. So Montel, you're on Facebook. If you search on Facebook aspirin, you're going to see all the different posts that I've done with them that you might find interesting. Daisy said, my OB has me taking baby aspirin when I'm supposed to stop taking it. So they say to take it up through delivery. That is the protocol. Now, that's not true for everybody. I think it's important to ask at every prenatal checkup, hey, remember I'm on aspirin. Are we still good? Right? Yeah. No pregnancy questions here, but I'm appreciative of you giving women factual, applicable answers. Thank you. That's what I'm here to do. All right. Any other questions? I know I skipped some. Oh, let's see. Priscilla on YouTube said, I'm 37 weeks pregnant. I've been feeling mild menstrual-like cramps. Is this a sign of the early phase of labor? It can be, but it also can just be that it's just the end of pregnancy. So just keep an eye out for the signs of labor. If you go to the pregnancy nurse, which is my link in my profile everywhere, type in signs of labor. I have a great post that shows the different signs of labor. And usually you'll have a few of those. They don't just travel. It's not usually just contractions. What does it mean when your cervix is thin? So your cervix is like a thick sweater, like you have like a turtleneck sweater. And as you imagine, if it was a tight turtleneck sweater, as you push your head through it, it starts to thin out. Same idea there. So your cervix usually, especially if it's your first baby, thins out before it dilates. So it's just thinning a little bit. It can be disconcerting. Yeah. Can you take anything for yeast infection 13 weeks pregnant? Talk with your provider. I'm not sure about that. When do you worry if baby is breech? I'm 29 weeks. Not at 29 weeks, maybe closer to like 33 or so. Yeah. How to increase chances of healthy pregnancy after a pregnancy loss? Just prenatal vitamins, eating the rainbow, things like that. Yeah. Period is 2 weeks late. When should I test? Usually the testing says, I don't know why it suddenly got so dark in here. I just liked my thing again. You can test when your period would be late. My doctor says I can't walk because it's too thin. Yeah, so keep talking with your provider, see what they say. Usually I've heard that they don't love like prolonged bed rest. So there you go. How can you tell if you're dilated? Your provider needs to check your cervix. That's really the best way to, yeah. What does a contraction feel like? Usually they start like menstrual cramps, sometimes in the front of your belly, sometimes in your back, and then they start to get harder and more painful. Yeah. If baby drops at 30 weeks, what does that mean for preterm labor? Nothing really. There's no indications of baby's position and possibly preterm labor. Now, if they dropped and they thinned your cervix, then you would have a higher chance of preterm labor. A conference I was just at talked a lot about how cervical thinning is a big indicator. Let me turn this on. A big indicator of preterm labor. Yeah, and they check that with an ultrasound, like a probe into the innards. Looks like a big vibrator they put inside, and then they check your cervix that way. How long does postpartum last for? And is it normal to feel sore 5 weeks later, like aching and fatigue? Lucy, that sort of sounds like you might have a fever. So I would check your temperature. Fatigue, yes, because baby's probably not letting you sleep very much. Yeah. If you have any questions, ask your provider. I would guess you have an appointment coming up, though, with your doctor, Lucy. I'm not sure. When do they start checking if you're dilated? Sometimes, like 36 weeks they start, but some providers don't until they think you're going into labor. At how many months postpartum is it recommended to try for another baby, normal delivery, and pregnancy? This conference, they were saying they really recommend 2 years between baby to baby. So that means you could get pregnant a year and 3 months after baby was born. But it happens earlier, and often there aren't any complications. So if you had it happen earlier, I wouldn't freak out. Yeah. I tested, but I drank a lot of water. Does that affect the outcome? It can like sort of dilute it. So I always recommend doing the first test first thing in the morning. Yeah. Hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I'm the creator of the online prenatal class for couples, the first hospital-based birth class on the internet, to where it has been perfected to get couples prepared in the easiest way possible now. It is fun, it is fast, it's available 24/7, and it is meant to prepare you and your partner together so that you can tackle pregnancy, parenting, all of it together. So come join me. You can always find it through the link in my profile or at onlineprenatalclass.com. Do you know at what point it would become physically unsafe to keep having children? I think that's something you talk with your provider about. It's not a general thing. Is it too early to announce at 5 weeks? I just did a post on this on the Pregnancy Nurse, so if you want to take a peek at it, but I think it's really up to each person. I did not want to announce early because I had infertility and I just didn't want to have that conversation if I lost the baby. So I think it's really up to each person, and everybody's different. And also there's different stages, right? Like my coworkers knew before my mom because I'm a nurse, and there are things that nurses should not be doing if they're pregnant. Things like x-ray, drugs that we shouldn't handle, things like that. So then I told my parents, then like close people, stuff like that. Parts of my C-section scar are raised. Would the silicone strips help? I'm not really sure. I think you might be able to give them a try. Ask your doctor. I'm not really sure how the silicone strips work. I'm 32 weeks. Can I start trying to start labor? We really want baby to stay in until at least 37 weeks, Tikia. My first two had ultrasounds at 8 weeks. This time they can't see me till 11 weeks, and it's not even an ultrasound. Oh, that's a bummer. They should schedule you for an early ultrasound. You can ask them what their plan is, stuff like that. I'm 21 weeks. I have sciatic pain since about 15 weeks. Is there a possibility of this stopping? A lot of times people have it early in pregnancy, and then it chills out after the body gets used to your uterus enlarging, and then it may come back. So I would ask your provider, maybe physical therapy can help you out, talk about some stretching and things you can do, light heat, stuff like that. Does it require not to eat while trying to give birth due to likely chance of sedation for a C-section? If you had like a super high chance of needing a C-section, I could see that possibly being important, but unless there's a reason that they foresee a C-section, I'm not a fan of it. Now, I will say that if you eat like a heavy meal, the chance of you seeing it again the other time is high. So I always recommend people eat lightly, not go crazy with their food. Yeah, nothing greasy or heavy, things like that. But ask your provider because it does vary. There are some people that I really think it's probably not a great time to eat. Because there is a chance of aspiration into your lungs if you were to vomit during surgery. Can you get pregnant with no implantation and bleeding? Yep. Some people have no bleeding. When do symptoms start, and does everyone get them? Nope, everybody's different. All right. I think we have, I'll be 30 weeks tomorrow. I'm having pain on my left lower back going down. Is that contractions? Probably not. I'm not sure what you mean by going down. Just keep an eye on it. Talk with your provider if you're having new pains that are consistent and you want things answered. I've been pregnant 6 times, so can't seem to get pregnant again. Only 3 live births. The average time for conception is 9 months. So sometimes you have to be patient. Probably you've gotten older in that time period, things like that. So talk with your provider. If you have any questions, there are some tests they can order just to see if it's like something simply wrong. Yeah. Just a reminder, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am the creator of the online prenatal class for couples, the easy way to get prepared for birth. I am so glad that you guys joined me for this live. It's been so fun to chat with you guys. If anybody has groin pain, let me tell you the 3 most recent posts on the pregnancy nurse. And you guys can always find these through the link in my profile. You'll just scroll down to recent articles. I talked about 5 fixes for groin pain. I talked about the saline lock, which is super helpful in labor. And I talked about how summer heat can hurt your pregnancy with a study that's pretty interesting about how pregnancy heat can affect you and your baby. Can you get pregnant without taking prenatal vitamins? Yes, prenatal vitamins aren't helping you get pregnant. They are helping baby stay safe while you're in the womb and help the like the spinal cord area fuse. I'm going to try epidural free this time. Will they try to push it on me if I'm struggling? They may offer it to you, and if you're not wanting it, then say no. If you'd rather not be asked, you can tell your nurse that. Although I do have to say that as a nurse, when we switch shifts, we always are asked, how are you doing with your pain? And then, we will say, are you managing it okay? Do you want me to talk about your options? And then you can say, I already know what my options are, and I'd prefer you not ask me for the rest of the shift. I'll ask you if I want it, something along those lines. But we are sort of required to make sure that you're coping with your pain on our initial assessment, because that other nurse could have been ignoring you the whole time, and we want to make sure that you're getting the things that you need. Are vivid dreams a common thing in pregnancy? Yes. I feel like my dreams were the craziest when I was pregnant, so I don't know why. Maybe because you sleep lighter? I don't know. Contracting every 5 to 7 minutes for about a minute. Is this early labor or active labor? Hard to say. Hopefully you're due. If you're not due, you need to talk with your provider. I hate vivid dreams. I had one where my dad and my brother, they're not tiny people, were running after a toy truck to like rob it. I don't know. It was crazy town. What can I do to treat sinus headaches during pregnancy? Sinus rinse. Talk with your provider about any medications you can take, like breathing in steam, or things like that. Ooh, it's the worst. 15 weeks pregnant, they said I have a placenta previa. How can I help that? There's really nothing you can do to help it. It just naturally grows. My online class, thank you so much, MS Pro. It starts at $89 and for the base class. And then if you want to get the one that includes baby care, baby sleep, communication provider, breastfeeding, nutrition, then that's $197. So it is super affordable. If most birth classes that have as much as mine cost in like the $600 range. So I really, really try to make it affordable for you guys so that you will get lots of people in there. So if you have any more questions about it, I would love to answer them. Does having gestational diabetes mean I'll have to get induced? If it is not controlled, I think they're going to strongly recommend that you get induced, but it really just depends on what's going on and what your blood sugars are. And then you need to take that into your own heart and decide for yourself, because they don't make the choice for your induction, you do. But if blood sugars are not controlled, I really do think that it is a good plan to get induced, though. Thank you for the heart puff. Is back pain normal during pregnancy? It definitely can be, but it can also be a sign of a bladder or kidney infection. So you need to be mindful if there's any other symptoms like that. Oh, I'm sorry. Hang in there with infertility. Can I choose if I want a C-section or not? Man, that really depends on your provider. There are some providers that will not do elective C-sections. There might be hospitals out there that also do not allow elective C-sections because people love to look at hospital C-section rates. If there's a reason you want to have a C-section, talk with them. I have a question. I'm 36 weeks. Why does it feel like baby is so heavy when I poop? I don't know. Probably just because you're bearing down and it's just kind of pushing against things. It's not unusual though, but talk with your provider if you have any concerns. First 2 pregnancy, I had to get induced 27 weeks due to high blood pressure. That is a very early induction. People need to talk about the cramps in early pregnancy. Haley, it's difficult because there are good cramps and bad cramps, and it's really hard to explain which are okay and which are not. Some random cramps might be okay, especially if they don't accompany bleeding, but I'm hesitant to like make a blanket statement about them because some could be leading to a chance of miscarriage. What exactly is a mucus plug and what is it for? It's mucus. Hello, magic. It sort of corks the womb off to like keep bad germs from getting in there. There's like a negative flow into the uterus and it pulls like dead skin cells, mucus, blood, and just creates this little cork at the end of the uterus. So then as your cervix starts to soften, that cork kind of falls out. Is having a heart rate of 120 all day normal for you or for your baby? 120 seems a little bit high for you. So yeah. Should I plan for 27 weeks this pregnancy? I mean, if you got induced at 27 weeks, it would have to be really severe. So I don't know. I've never induced someone at 27 weeks. I have done emergency C-sections, but I've never done an induction at 27 weeks. That's just my experience. Okay, thanks so much for joining. Thanks for the questions about the online prenatal class for couples. We're just getting a couple more questions. 29 weeks, there's spotting of blood after I wipe from using the bathroom. What does that mean? Just a little bit of spotting. I don't know. You might want to call your provider, but if it was like one and done, plus sometimes you can spot from just like tearing with sex or an exam or something like that. Do you recommend starting acupuncture in the last 4 weeks of pregnancy? Not usually. What is considered full term? Is it 37 to 41? So 40 weeks is considered full term, but anything past 37 weeks, that baby is considered term. It used to be 36 weeks and now it's 37. They just found that babies just did a lot better if we waited till 37 weeks. All right. Thanks so much, you guys. It's been on for just about half an hour. So fun to answer everybody's questions. Come join me in the online prenatal class for couples where we can get you prepared. Sarah just said she's 34 weeks. Come join me. That's a great time to get prepared in the online prenatal class for couples. You can always find it through the link in my profile or at onlineprenatalclass.com. And if you ever have a question about the class, you can contact me on my website or ask questions in any of my videos. I would be happy to answer them as well. Leanne just said, I had a LEEP done. Do you think it will affect this pregnancy or delivery? It can affect how your uterus dilates. So I would ask or tell your nurse, make sure that it's noted that you had a LEEP because sometimes your cervix doesn't open as well. All right. Thanks for joining me, you guys. Have a great one. We'll talk to you later. Bye.